Okay, so we are here tonight to just offer a little bit of an open conversation with a couple members from the COVID task force, specifically in hopes of, when we planned this, our hope was to offer a place for people to vent like frustrations about mask policies or just kind of get comfortable with some of the changes in church format as we prepared for in-person service. And as I'm sure everyone in this room is conscious of, like, things are just changing and numbers aren't looking good and things are feeling scary, I think, again, for a lot of people. So that shifts the content of this, or that shifts the feeling of this meeting from being a place to let people kind of vent and say, like, I don't want to wear a mask, to, are we good with this? And how are things being decided and what's going on? So, we're gonna do our very best to answer questions tonight, to provide some information, and I just ask for your grace, because there are quite possibly questions that you have that we don't have answers to yet. But I'm gonna introduce the task force members who are here, and then I'm going to pass it to Tana Clues. So I'll start with Tana Clues, who's here, serves on the board of trustees and is the chair of our task force. And she'll be doing a little transition from car to her house as the meeting's going on, because she's a busy lady. Tana also has substantial legal experience, so that lens has been really helpful with the task force. She works for the Women's Foundation as well, so works with another large organization that's also been grappling with COVID policies and setting safety procedures and all of this. So she's brought all of those tools to our conversations. The other member of the task force who's present with us tonight is Rich DiPentima. Rich is an epidemiologist who serves on the Mayor's Blue Ribbon Task Force. Are you still convening, Rich?
Yeah,
in that?
We're going to meet on Thursday, an emergency meeting. So things will change possibly next week.
So Rich has been a tremendous tool for us throughout this past year. He has shown up with so much information, knowledge, access to conversations. He's been able to anticipate and know things that we didn't know yet were coming around city policy. And we've just been hugely grateful to Rich's service on this task force. Our task force also includes Dave Toot, who is a surgeon, and so obviously brings some other medical expertise to our conversations. Andrew Bairstow, who is a school administrator in the York School District, which has been really helpful to hear some of the ways that that institutional space has been navigating COVID policy. Steve Pelletier, who's plugged in with emergency services and has a pretty solid background in a lot of responsive policy setting as well. And I feel like I'm forgetting someone, but that's a good little glimpse of our task force. We pulled together a task force of people who we hoped would be bringing complementary portfolios of experience that would help us navigate the complexity of this ongoing health crisis and community crisis. And so that's just a little overview of who we are. I have been serving with the task force as a staff support, and Jen Leiden has been here all along with us as well, doing the incredibly helpful work of scribing notes for us, but also bringing the lens of her kind of the questions around, how is this all going to work? So having her present for this work has been really helpful too, for us to get our heads around how to apply policy and what questions are going to come up, and be able to talk with some expertise to our renters and people who use our space. So before I pass it to Tana, are there any questions around that little beginning overview that anyone has? Great. Okay. I'm going to pass it to you, Tana.
Great. Hi, everybody. It's good to see your faces. I am hugely embarrassed. While I am a busy person, as you can tell, I've come from working out. So I wasn't planning on showing my face while I spoke, but I know it's not fun to just look at someone's profile photo. So once I'm done, I'm going to shut off my video and start driving home, but still listening and participating in the conversation. So my role actually as chair of the COVID task force is I'm really more of a liaison to the board. Quite frankly, while the COVID task force has been charged with making recommendations around in-person services and number of people who can be in the sanctuary, it's actually been the board of directors who has approved and moved through most of, if not all, actually that's not true. They have approved all of the protocol that was either recommended by the COVID task force and or our legal counsel. So I'm going to skip ahead a little bit, quite frankly, to the brass tacks and just talk a little bit about the protocols that are in place for us to come back to in-person services. I know that you received an email, and I know we've gotten some questions about that. Everything that you received and the documents either that need to be signed, and as a reminder of that, there is a liability waiver as well as a health screening, and we call that second the health screening commitment for in-person worship. Those documents and really the principle and substance of those documents were created last fall in September to be used. Quite frankly, we had to spring into action as we were faced with the possibility of having a wedding at our church. So quite frankly, we weren't even ready to really begin thinking about what it meant for anyone to be in our sanctuary, whether that be a rental, whether that be a friend's organization using the space, or any of our members. So while that wedding never took place, we have been utilizing the church. Different groups have been utilizing the church, and they have been using these documents. So our religious education, OWL kids and volunteers, our search committee, et cetera, they have been, they had to fill out those waivers. They had to go through and do the health screening. So the protocols that we've put in place are not only for members of the church, but they are also for anyone else who attends and steps foot inside. As board members, we have obviously a fiduciary responsibility to protect the organization, but also the safety of our congregation. So we utilized both the COVID task force expertise, which I would not necessarily put myself in that place, as well as legal counsel, who worked directly with us to make sure that the church was protected and also that we could ensure a safe space within our congregation. So I have heard, I'm going to skip ahead a little bit to just say that I have heard some concerns around whether or not a church needs a liability waiver. And I want to be really clear that all of this, everything from coming back to two sessions on Sundays in person, as well as mask wearing, how many people can be in the church, the documents that need to be signed, just like everything else during COVID, we are constantly reviewing both what the latest guidelines are, as well as what the best practices are. So as we roll out in-person service, we will be paying attention to the processes and determining whether or not it's feasible to continue doing what we're doing, whether or not the numbers continue to uptick, and we might have to switch back to a hybrid or more specifically a streaming service. So just know that we are frequently having conversations at the COVID task force, as well as at the board, about what is best for the church, what is best for our community, and at the end of the day, how we can protect our members, the visitors to our church, and of course, South Church as an organization. So we are open to questions that you might have, things that we can answer for you about process, about the particulars of coming back. I will say that because this was approved by our board of directors, what we have in place now, the processes that we have in place now will remain in place until the board of directors were to make any changes there. So just as a point of process, it is not the COVID task force that has enforced or put together these documents. It is the board of directors who's approved this, and that is why it's official protocol at this point in time. Kirsten, I'm going to let you facilitate from here on out. So I'm happy to answer any questions.
Okie dokie. But let me first see if there are questions around what Tana just shared. I have a few questions I received via email today from Jonathan, and I thought we might go through those questions as a way to get conversation started. But any information you've already heard that someone has any questions about, please raise your hand before I segue into Jonathan's. Rita.
This is just a technical question. The two forms that Tana mentioned, where are they and how do I get to sign them?
Sure. So in the last newsletter, there was an update about COVID at the bottom of the newsletter, but it is also on the website, and I will put in actually Jen Leiden will put in the chat box link, the link to the website page that has a copy of those forms. What we're currently, and again, this could change. The task force is certainly going to be meeting before September 12th. We are in a moving target. And so questions about things, and I don't really think this is a great idea. We're very much receiving information around that, or I wish it was like this, or I'm concerned about this. All of this stuff, all of the concerns and thoughts that you all have are important. The process for that is to take those things in, and then the COVID task force have a conversation about them. What the process we've followed throughout this year is the COVID task force having in-depth conversation around things, making recommendations to the board, and the board then finalizing large policy that helps kind of move us forward. So we will still continue to follow that process, but your feedback and thoughts are very much being heard, and so conversations continue. The forms, if we follow the process as we had planned to for September 12th, the forms are, it's a two-sided waiver and what we're calling a health commitment. That is both are a one-time request from congregants that you read through and sign. The waiver is essentially a very articulated, this is not, there is risk to us coming together, and you are recognizing that that risk exists. And for me, what I really love about that is that it is very clear for someone who's coming to us for the first time, coming into church. It's a very clear process of consent of, hey, we're glad you're here. Also, there is a pandemic right now, and it is dangerous in these ways, and this is what we know about it, and we want to make sure you know this too. And then the health commitment says, when you're coming to church on Sunday morning, if you have a fever, or if you know you've been exposed to someone in the last week, or if all of that list of things that we've been answering when we come to doctor's appointments and things, it's saying this is an ongoing commitment you're making that you won't come to church if these things are true. And so in a sense, it's kind of a very active health piece of a covenant, right? That people are reading through and committing to. And so that's what those forms are, Rita, and the link on that page will take you to them. We will have them, paper copies of them at church every Sunday until that policy changes. So you don't need to worry about printing them out in advance. The first couple weeks of church, we will actually have tables set up outside, assuming the weather agrees with us, so that people can go through that part, get their sticker on their name tag that says, I did it, I did that process. And then once you've got that sticker, you'll be good to go. We'll also keep a list. So if you forget your name tag, we can give you a sticker quick based on the list that we've done. Betty, I see your hand raised.
Yeah, I filled out, I think the same forms for a meeting at church. So would I do it again when I come to church?
Yeah, so a part of our COVID policy that has been in place since we started having small group events at church. So since February, the first groups that were meeting at church were the search committee was meeting in person, and OWL classes were meeting in person. And so we have event by event waivers. As we come into the fall, for recurring groups, we may do a similar thing to what we're doing for worship, where we have a waiver that will apply for the 6 weeks of a program or for the year of a small group ministry. But the waivers are specific to the thing you're participating in. So the waiver for worship just just works for worship. But if you're coming to other things, we are, at least right now, still engaging in that process specific to each of those things. And partly what that helps us do is keep track of who's where and what kind of group sizes we have. So that was also a piece of the beginning of creating this. Was when we were creating this, we were needing to do contact tracing. We were needing to, so again, there's a million different moving pieces to setting policy and procedure around COVID. I
That's
hope
great.
that answers your
Yeah,
question.
thanks for explaining it.
Mhm. Other questions before I lift up Jonathan's? Okay. All right. So Jonathan graciously sent in advance a list of questions, which I appreciated, Jonathan, because some of them were a little complex. And so it's nice to be able to think about them a little bit. I'm going to put Rich on the spot to answer a bunch of these. And the first two were both kind of different versions of if we could speak to how we have evaluated the risk of exposure and transmission of the virus, and what is the risk and exposure. And so I'm going to ask if Rich could give us a little overview of kind of how those conversations have been going to start that off.
Yeah, of course, the risk is a very difficult thing to measure. There's both the population risk when you look at the congregation as a whole and what the risk is for population, and then there's the individual risk, which could be a lot different than the population risk. So each congregant has to assess, beside us looking at the congregation and the risk associated with doing or not doing certain things, each individual has to monitor and each calculate their own risk based on their own individual situation. Have they been vaccinated? Are they over 60, 70, 80 years old? Do they have any other chronic conditions? What might put them at greater risk than the average population or the average congregant, if you will? So what we look at, and we try to look at the same data that the state looks at, we're looking at the numbers that are happening in our vicinity, particularly Rockingham County and Portsmouth area, and looking at what's happening, in particular in terms of the Delta variant. And what we're seeing is not very encouraging. We're seeing each week an increase in the number of cases. We're seeing an increase in the positivity rate, which is the number of people who test for COVID, that the rate of positivity is increasing amongst those people that are tested. We're seeing increase in hospitalizations and somewhat in deaths as well. So the risk is changing because of what's happening with the Delta variant, which happens to be a variant that's about 60% more transmissible than the Alpha variant, that the initial virus that we were dealing with. So again, it's a moving target. Things may change from day to day as the numbers change. So that's where we're at. The vaccination, we're also looking at the vaccination rates, which are not great. We have about 57% of the population in New Hampshire that has had 2 doses of vaccine. About 65% have had 1 dose. And of course, we've also seen breakthrough infections with people who have been fully vaccinated with the Delta variant. People have had breakthrough infections. Fortunately, most people who have a breakthrough infection post-vaccination have had mild disease. So the vaccine is very, very effective in terms of preventing serious disease, hospitalization, and death. It may not prevent you from contracting or getting infected. The other part of that is, though, even though you're vaccinated, you may get a mild case, you can still potentially spread that to other people who have not been vaccinated particularly. And we have a whole cohort of children less than age 12 who have not and cannot be vaccinated yet. And that probably won't change until late this year or early next year. So we have that whole population that we have to be concerned about, as well as the issue of all of us who have been vaccinated. We're facing the issue now of waning immunity. It looks like they're going to make recommendations for people who've been vaccinated their second dose 6 months previous, that they will be now offering booster shots for people who've received 2 doses of vaccine, at least 6 months, the second dose, or with the case of Johnson & Johnson, 6 months post their last the dose. So that's another issue we're dealing with in terms of waning immunity, even amongst the vaccinated population. So it's adds another whole, question in terms of assessing the risk for the congregation and for the individuals.
So, and just to follow up with that, another question that Jonathan had that is related to the picture you're painting is what considerations drove the decision to the benefits of in-person service being greater than the risk of exposure and transition? In other words, why are we going back to in-person versus not?
Yeah, it's an interesting question, and it's a hard one to answer. Again, a lot of that depends on the individual. There's obviously, we cannot say coming to a service is risk-free. That would be irresponsible to say that. We know there will be risk. And it's even very hard for us from day to day, even to anybody, to quantify what that risk actually means, both to the population and to individuals. So it's what it is. And individuals, again, have to make up their own mind in terms of whether they want to accept a certain amount of risk to go to church for the benefits that they derive from being in the congregation and participating in a service at church. From my own experience, for example, they've opened the Spinnaker Point gym. Obviously there's a risk going to this gym, and I've decided, based on my history and so forth, I'm not going back to the Spinnaker Point gym at this point to do my exercises, because I can do exercise somewhere else that's safer and not put me at any risk at all. So I have to weigh that. And the same, all of us have to weigh the risk. Is that participation in church, even with wearing masks and all the constraints that go along with being in a congregation with all these things that we have to deal with, is that benefit to me, being part of that congregation and participating in a worship service, worth the risk that I may take that's not quantifiable at this point?
Okay, if there's a comment about something before I move to the next question, you can always put your hand up if there's something that you want to follow up on before I change the subject. Another question that Jonathan asked, because Jonathan has put some thought here. Appreciate that, Jonathan. What is the plan to react to a transmission event when one occurs as a result of a service at South Church? And I will start us off with this, but then again, ask if there's anything you want to add, Rich or Tana. We don't currently have a contact tracing plan. So the city for a while was requiring that, and our initial sort of slow opening of doing some smaller event things involved keeping a roster of people who were present for any given event so that we could contact those people if there was an exposure. And in fact, I had to use that contact tracing procedure with the city for our coming of age camping trip, which did not result in anyone getting COVID, but one of the kids that participated on the camping trip had been exposed and tested positive after the trip. So all of our coming of age kids had to quarantine for 10 days following that trip. And then literally the day that their quarantine ended, the policy of contact tracing and requiring quarantine ended also. So it felt a little bit frustrating. But that being said, that requirement of the city did end. And so we have in turn stopped requiring keeping that list because it hasn't been required. That said, it is on the COVID task force's sort of last to-do item as we approach September 12th to articulate some kind of process for letting people know if a positive case if we find out about a positive case. And certainly if we find out about a positive case, we would ask that person, who were you around? But we have not yet articulated exactly what that process or plan is going to be. My thought is that we will have on the website, on the page where COVID news is that we will have a place where we can put that update information, like, hey, if you attended service on such and such a date, that we'll include it somehow in our news in that way. But it's not a perfect system. So unless we want to implement some procedure for signing people in on a Sunday morning, I don't know how we can do a thorough contact tracing. It's complicated. Church is complicated on Sunday morning because it's an open door and people walk in. And so we're weighing those balances, but there is not a set articulated process for that right now. It is something that the task force is going to be talking about before we get to in-person service. You want to add anything to that, Rich or Tana?
Obviously, anytime you're dealing with any of these issues, there's the confidentiality component that you have to consider. If someone is test positive and they were at a service, there's a certain limit. So how much you could share with other people in terms of who they may have been exposed to. We could interview potentially the person who's positive, and they might give us an idea. Oh yeah, I was sitting next to so-and-so or so-and-so, or we went to breakfast afterwards with so-and-so and so-and-so. And they, might even notify the people that they had contact with themselves in terms of having an exposure. The state is not doing any contact tracing anymore as well. That also brings up another issue, sort of a sideline to it. If someone is identified as having been a contact to a case, somebody who's infected, they may not necessarily be ill, but they've been infected. If you have been vaccinated, fully vaccinated, there's nothing really at that point to do other than to monitor your symptoms and see if you develop any symptoms. And then if you do, obviously get tested. And then if you do test positive and develop any symptoms at all and you're at high risk, you would want to get with your physician or provider to consider the reality of maybe you need the monoclonal antibody treatment, which could prevent serious disease. If you have been exposed to somebody and you have not been vaccinated, then that might be a consideration for what's called post-exposure prophylaxis. If you're at high risk of developing severe disease, you were exposed to someone with COVID and you have not been fully vaccinated, then you would be eligible to get the treatment with monoclonal antibody post-exposure prophylaxis, but only for non-vaccinated people. I'm assuming and hoping and praying that everybody who is eligible to get the vaccine has gotten the vaccine. And if you haven't, I would urge you to not waste any time. Right after this, go over to CVS and get a shot. So the vaccines are working, they're safe, they're effective. They may not prevent infection, but they prevent severe disease and they do prevent death almost 100% of the time.
Right. Yeah, and I would just lift up that that's a big part of why we're talking about coming back to in-person church, is that our population is largely vaccinated, and we really do believe that that impacts our collective safety significantly. It is, yeah, it's not without risk, but it is far better than where we were prior to that. So even though numbers are going up, yeah. Other question on here. There was one more question, I think.
I have a question, if it's okay.
Yes.
And I don't know if you mentioned this or not, but you're not requiring people to be vaccinated. I'm guessing. I didn't hear you say that was the case. And when I was at a meeting at church, we did have to show that we were vaccinated. So I just wondered, what was the process? I mean, I know there's lots of, reasons why you don't want to, but I would love it if you did. So I just wondered, what's the reasoning for not asking people to be vaccinated?
Yeah. So there's a couple things about that. One, there is a chunk of our population that can't be vaccinated. So anyone under 12 can't be vaccinated. As Rich was saying in our conversation before this started, there are very, very few at this point medical reasons not to be vaccinated, as if you are eligible by age, but having a chunk of our people who are not able to be vaccinated makes it a bit of a moot point to say you must be vaccinated to come to service, unless we say we're only going to have church for people over 12 years old. And I have to say, like, that's not our whole community. And if the age range that couldn't get this vaccine were people over 60, would we be making the same decision of we'll just have church and the people over 60 can stay home? Like, there's maybe there are people in this room who would still be of that opinion, but I personally am of the opinion that we need to make decisions that are as inclusive as possible of the people within our church. And I recognize that there are always examples of people who can't, someone who has mobility issues and can't get themselves, or doesn't have a car and can't get themselves to church, right? There, we miss the mark, but we sure as heck should be trying as hard as possible to be as inclusive as possible to the entirety of our community. So that's of value, and we may not be on the same page as that, everyone, but for me personally, I feel really strongly that we not create something that is exclusive to, especially to children, because we often are excluding of children in the ways that we function in our culture. So we could have a debate about that, but that's one piece. The other piece is that being vaccinated, while it makes you safer, if you get exposed, you can still very much be carrying this variant. And so there is also a degree to which it's a bit of a moot point, because even if everyone in the sanctuary is vaccinated, we can still have COVID in the sanctuary. And everyone in that sanctuary is still able to pass it around to one another and then take it out of the sanctuary to their communities where there are other people who aren't vaccinated. So it doesn't, there is a degree to which it gives a false sense of security of we're all vaccinated with the way this variant is behaving. When this variant wasn't so prevalent, we actually had policies, and perhaps, Betty, this is what you were alluding to, although I didn't know that anyone was requiring seeing proof of a vaccine, but we had a policy of, if you are a defined group, like say a small group ministry group, there's 10 people and you meet every week or month or what have you, and everyone in that group is vaccinated, you could choose to take your mask off. So I don't know how many people in this room used that during that period of time, but we have asked for that to stop happening because there is not the same degree of safety now. So the moving target of this means that now with this variant, even if everyone in the room is vaccinated, we can still be spreading COVID to one another. And so the cumbersomeness of checking people's cards, of keeping records of who's vaccinated, doesn't actually pay off in any sort of increased safety around spread. So I hope that answers that question.
I would just add that in a perfect world where everybody had equal access to the vaccine from age 0 to whatever, that would be, I think, a reasonable thing to require. Unfortunately, we're not there yet. Hopefully we'll get at least down to age 5 by the end of the year or early next year. The other fact to consider, not only will the child under 12 be excluded, but probably maybe one or a parent or a guardian or somebody who takes care of that child probably would be excluded too, because they may have to stay with the child if it's a young child, be at home, not by themselves. So probably now you're excluding at least one of the another adult from the congregation as well. That's a tough call. And the other point is, even because CDC now has changed the recommendation, even if you are fully vaccinated, you still have to wear masks indoors in public settings.
Thank you both. I really appreciate it. And I value the, being inclusive, and I hadn't thought about the kids. So thank you.
Yeah, totally. Rita.
Yeah, unmute, Rita, you're muted.
I want want to clarify because we're just now getting ready to register for small groups. If small groups choose to be in person and everyone is vaccinated, they still must wear a mask?
Indoor.
Is
Yes.
that?
Yes.
Whoa, okay.
Mhm. Yeah.
I think we'll be a lot on Zoom,
Mhm.
but I don't know. Okay, thank you very much. I didn't know that.
Yeah. Yeah, that has shifted.
Right.
That is a part of this moving target. Yes.
When did it shift?
Uh,
A week and a half ago, 2 weeks ago.
Oh, that's why I don't know it. Thank you.
Other questions? There is one more question on Jonathan's list that I don't think we've answered yet, which was how will mitigation measures be monitored to maintain compliance? And I imagine the most simple example of that is how are we going to enforce people wearing masks at service? But also, just kind of all of this. And I mean, I'm hoping that the peer pressure of it, we don't have security plans, but certainly if there is someone who comes to the sanctuary who is not wearing a mask, we will be approaching them and talking to them about it. I'm not anticipating that to be a problem. We've had quite a few events, large events, in the last couple months, memorials of upwards of 150 people, weddings, all kinds of different pretty large gatherings. And those weren't even South Church people specifically, and people have been compliant. I actually think we were in more of a risk of that a few weeks ago than we are now, because of the variant and because of the direction it's going. People, I think, get it. But in terms of the kind of compliance piece, we're pretty serious about it, and we'll say something to someone if they come in. The logistics of waivers and health commitments and things like that are a little trickier. But Rebecca Blake has already really proactively been, she's here waving, been talking with me from her portfolio of helping lead the welcomers, the greeting committee, of like, okay, how are we doing this? And so we're talking through like, what does it look like on Sunday morning, and how do we include things like reading the health commitment, and signing that, and keeping track of visitors in a different way. So we're thinking that through. And again, we're going to be learning as we go, and it won't be perfect. And if people observe, hey, this isn't working well, or I have a better idea, please tell us, because when you're in the weeds, sometimes you don't see the great idea. So we very much welcome the good ideas when you have them.
Right. And this is Tana. From a process standpoint, the more people who are able to print those forms and bring them with them to that first in-person service, if they choose to be in person, the better. And we will likely have some way on our name tag, just like with ABC, that it will note that those forms have been submitted. So we will keep track of who has submitted those forms. And again, it will make life much easier if we can really encourage people, if they can, to bring those forms with them on their first service back. And if not, we will have them there, and you don't have to do them more than once as it relates to worship.
Yeah. And I will say, having gotten through this past Sunday, which was live streamed for the first time, we do have a new degree of limberness that I feel some relief about. So if the numbers do increase more, and it does become which is possible, that the numbers keep climbing and we do decide not to have in-person worship, or we start with in-person worship and 2 weeks in, we realize it's not sustainable to do that right now. Or, like one of the things they're talking about the next sort of period of time with COVID is that it's going to be a bit of a moving target as it moves from being a pandemic to being something that's endemic, that we just live with and have vaccines every year, which is probably what Rich has shared with us, is probably where we're headed somewhere down the line, is that this thing's going to exist, but we will get to a place where we have much more balance around it. right now, it could be a moving target. What's nice is I think we will probably be able to still live stream, even if we're not doing in-person worship. So we won't, I hope, have to shift all the way back to sort of producing things at home. Or, you know, we have this new possibility, which gives us some more options as a community and maybe allows us to not change quite as much as we had to do last March, which I know was exhausting for the staff, but also for so many of our volunteers that just threw themselves into an entirely different medium of offering church. You know, we moved our whole institution onto an online format in a period of a week and a half. It was pretty miraculous and very exhausting. So I know for myself, I'm tired, and I'm sure there are other people in this room who are tired. And I just want to honor it and say, like, I feel you, and we're gonna really try to make these transitions, whatever they are ahead of us, as kind and considerate of our hearts and our needs as human beings as we can, because this has been a long go of it already. And I know I wish it was over. I'm sure many of you do too. I don't see any other questions on Jonathan's list, but yeah, go ahead.
Yeah, no, I just, Lori, I know that you had forwarded some questions to us, and I see that you have a question in the chat. I'm wondering if maybe you want to ask that to the group so that we can address that.
Yeah, I can read it out loud. Oh, go ahead, Lori.
No, I will. I thought putting it in the chat was putting it out to the group, but
yeah, sorry.
So I have a lot of concerns about the legal waiver portion of the document, which I had no idea has been around since 2020. I haven't seen it before. I've been meeting in the church, had meetings in the church, and we planned, among other things, a major annual budget campaign starter party at the church, which we might not have done had we known that this was going to be the thing, because I just don't know how we're going to implement it. I don't know who's responsible for it. I don't know how it's supposed to work in light of, you know, asking people to give us a whole lot of money and agree not to sue us at the same time. But in terms of being a church, I really do have some deep-seated reaction to a community that stands up on a regular basis and says that we trust in each other's good intentions, and then saying, but not enough for you not to sue us if you get COVID here. And also, you know, having a little bit of not a lawyer, just spent a lot of time with them over the last several decades. I don't understand what we gain from having that provision in there. If you know, if we're giving someone grounds to sue us because we're not taking care of our protocols, then the waiver is not going to help. And if we are, then, you know, what are the grounds for a lawsuit?
So I'm happy to take on a number of those. And I, again, want to just reiterate what I said before, which is this is the current process in place. They are the protocols that have been established. They were established last fall. Those potentially could change, but I think a couple things to keep in mind is that our service is not only for members, it's also for anyone who walks in the street. So trying to delineate between the in and the out is pretty tough, right? And when we first were putting this together, and I should say the in and the out, those who follow the covenant and those who do not, right? Or those who are not necessarily members, who may not even know what the covenant of right relations is. When we first put this together, we spent a bunch of time looking at what our church liability insurance covered. And there is nothing in there for pandemics, right? I mean, every church, every institution out there was searching and looking through their insurance waivers. Certainly, we would expect that a covenant of right relations would cover something like that. But in fact, there is no legal protection to suggest or any sort of get by free pass because of that covenant. So again, I completely understand your concern about that and thinking that it's antithetical to maybe what you thought was appropriate for church, but I have to go back to, at the end of the day, for me as a member of the board of this church, at the end of the day, I have fiduciary responsibility to protect the church. And this is one of the ways that we can do that. And I would hope that members would see that as us really honoring our job, that certainly we don't anticipate and certainly hope that no member of our church, if they were to catch COVID or someone in their family were to die from COVID as a result of them catching it in our church, that they would sue the church. But no one can guarantee that. And we want the church to be around forever. So we are protecting the church as best we can. And we could, as a board, decide that we are going to do away with the waivers in the future. There is not a lot of case law around this at this point. So again, out of an abundance of caution, back when we suddenly were faced with an expedited return to church because of the super spreader wedding debacle, it made us have to think about that both for renters, but also for anyone else who wanted to come back. Soon after, the search committee wanted to start meeting in person. OWL and religious education wanted to start meeting in person. So we did have to think about that. And the waiver was created. The waivers were created not just for renters, but also for anyone, members or not, who were to step forward and need to use our church.
Completely on board with the acceptance of personal liability and the assumption of risk. I just don't see, I still don't see. And I just, again, I don't see if South Church is following state, local guidelines and going above and beyond them in many cases, how there could possibly be grounds for a lawsuit. At best, it's off-putting. At worst, it's a little bit. I think it can be relationship harming. So I would urge the board to take a look at just dropping that legal language. The rest of the document is brilliant, and I think does what you would want it to do. Secondly, though, since it is the current policy, and we have this fundraiser coming up on September 19th, who's going to stand at the door and collect these, and who are the enforcers?
So at this point in time, it would be depends on who's staffing that event in terms of our actual staff, as well as the committee chairs and volunteers who are staffing that event. And if you haven't heard about this, Lori, certainly you're hearing about it now, and we can work with you to learn more in the future. I want to just flip that on its head for just a minute. As a donor, I would certainly want to know that all of the necessary protections of this institution is in place. And it's out of an abundance of caution, not out of an assumption. When you go to anything and you sign something, 99.9% of the people who sign any sort of waiver, it doesn't apply to them. It applies to the person who it's intended for, right? And that's what we are trying to protect. We are way too early in this at this moment in time to know whether or not there is going to be case law. And as someone who's trained to think about the worst case scenario, yeah, I actually can think of ways in which someone could possibly have some legal standing if we completely threw out everything that we need and should be doing to protect the church. But I do, Lori, I just also want to say, I really do hear you. And we are, we certainly got your email and your questions. I expect that at our next board meeting, we're going to be talking more about that. For the time being, these are the protocols that the board approved, and we will continue to utilize these, but that could change. And I really appreciate you bringing up these points and your concerns about that. We really appreciate that.
Yeah, the only thing I would add to that, and I appreciate both sides of this conversation, is the thing I like about that waiver is that it is very explicitly asking people to stop and think and be conscious of the risk that they are taking on and consent to it. And so that isn't a counter argument to your to your observation of the legal language, et cetera. But the actual process of saying to someone, this is what's happening right now, and you need to be conscious of these risks and really decide if this is something you're willing to take on, to me feels very responsible in a moment like this. And so I'm just throwing that out there as another lens of how I've received that process, and how I've engaged with people about that process is like, we're not trying to pretend that this is not an ongoing crisis, or that we are not, that there is some sort of magic lack of risk. And so, and just for what it's worth, it does feel very much to me like a healthy way of requiring people to stop and think. And that to me feels helpful in the moment of COVID, because people aren't necessarily thinking, they're just kind of going along with whatever the current group of people around them are doing, right? There's a lot of peer pressure and decisions that are made on the fly without thoughtfulness. So anything that's going to cause people to stop and say, okay, hold on a second, I want to think about this. Is this something I want to do? To me, helps them with that practice. And that feels like a healthy cultural practice. So more to come on that, because clearly there's conversations going on for this. Does anyone have anything they'd like to add to that to a comment around the waivers before we move on? I did see a quick comment from Laura Montville I want to touch on. Yeah.
No,
Rita.
I'm all set, Kirsten. I was just qualifying that if you're outside, you don't have to have a mask. I just want to make sure I understood that.
Masks are optional outdoors. Yep.
Yep.
Yep. Rita, go ahead.
I haven't seen the waiver, so I don't know what the language sounds like. But I would certainly second what Lori said. If there's any way to make it less legalese, I would really support that. I mean, I get the point about you're consenting, and I think that's true. I'm imagining we're doing that if we have an in-person group for a small group ministry. And that is important.
Yeah.
To have everyone's consent. So but if it's a legal is put off to me. So I don't want to have my covenant of right relations in the middle of legal language unless I absolutely have to.
Lori.
I will say the waiver is very well written. It's very clear. It's in plain English. It states out exactly what we agree to do to be participating in an event or and I'm absolutely fine with that. I just want to rip off the bottom 3 inches and sign it and be good. I mean, this is, at the end of the day, this is my church. Yeah. This is my church.
Can I clarify? So what you're saying, what you would like to take off is the part that says, I take these responsibilities seriously.
No, I like that part.
Okay, what's the last, tell me specifically, the waiver of lawsuit and liability?
Yep.
Yeah. Every legal counsel would probably be cringing at the moment.
Well, interesting. Yeah. I don't know, Tana. I mean, I talked to a lawyer a friend of mine who's a contract lawyer about this, and she's like, it won't work because either you're doing what you need to do and there's no grounds, or you're not doing what you need to do and it'll never pass the grieving widow test on, in front of a jury. It's kind of so.
Yes. Well, we're trained to argue every side of that. I could say that exact thing to you, but I could also say, and what your friend would also say to you, yes, but at the same time, without the existence of this, there is an additional compelling case to say the church did not do everything in their power to try to mitigate risk and to make you aware of what that is. So you could go down, and again, please remember where we're coming from, right? Where the board is coming from, where our legal counsel in this was to protect the institution of the church in what is a highly litigious society. And I think from that, if you step back to say that is what the board's responsibility is to be a fiduciary, right? Your responsibility, I would imagine, Lori, is to be a good member, right? To come in right relations, et cetera. I think that our threshold's a little bit higher. That said, it could change. The board could decide to do away with the waiver. But again, my personal opinion is I would go along with that if there was a strong case for that. If our legal counsel said, yes, you no longer need that. They have not said that, by the way, but you no longer need this. And that we were going to close our services to non-members, that we are going to say, no, I'm sorry. We only can have members attend who have agreed to this covenant of right relations.
No.
That last piece is the hardest thing for me to get behind.
I don't believe for a second that our covenant of right relations has any legal standing or would I just thought it conducted who we were as a people. I also don't know, there are very few lawyers who would say you have to use every possible, I mean, there are lawyers who probably say, well, let's have people put up a bond in case that, it's just, I don't know. It seems like we've crossed a line that I don't like, and I have to sign the thing because I'm a worship associate, 3 weeks from now. I don't want to, I really don't want to, but I'm going to, but I hate it. I just got to say, it makes my stomach turn every time I look at it and read it. I believe in everybody's good intentions. I completely support the board in doing what they feel like they need to do. I think we've gone too far as a church, not just as a nonprofit organization, but as a church. So, and we go forward from here together somehow.
Can I ask you one more question about that, Lori? You don't want to sign it because of what it stands for, or for you personally, the individual, why don't you want to sign it?
Because I can't reconcile the fact that the church to which I am committed and to which I am committed to serve is asking me to do it.
Do what?
To absolve, to indemnify you from any harm that may befall me by virtue of my attending the church. I mean, we didn't do it when there were slates falling off the roof. So
we probably should have.
That's a really good point.
Yeah. So you're, and I just want to make sure I totally understand. You do not, you're offended. Maybe I shouldn't use that word. Insert whatever you want there, by the fact that you are being asked to sign away your rights and to indemnify the church, to sign away your rights to sue the church.
That I'm being asked.
Yeah.
That is being brought to, that I'm being asked to enter into a legal contract, a construct with an institution with which I thought I had a spiritual contract. That's, and I realize the two might not be mutually exclusive, but it kind of feels like it, because like all of a sudden that's not good enough. So we got to do this. I'm hurt by it, but we'll figure it out.
Yeah. No, I really appreciate you giving your feelings about that. I really do. And I think some people probably feel similarly and some people feel differently. And it's kind of, it's just like anything. It's the question that Jonathan asked earlier about like, how is the value of in-person service outweighing the risk? It may not be, right? It may not be. And people don't have to sign this if they don't want to come to church during a pandemic, because it's an assumption of risk. It is us, the church, saying, okay, yes, we will allow you back, but we know that someone could get COVID from a member of our church, from staff at our church, and they could die. And we're going to hold service anyway. That's a huge burden. I mean, that's a big burden. I don't know that we should be back in person. Look at the demographic of our church.
Yep.
It worries me a lot.
Assumption of risk, absolutely not a problem.
Yeah. Well, I really appreciate the details too, because I think that will help drive the conversation that's surely coming. So thank you.
Yeah, I agree. Thank you, Lori.
Ingrid.
Just a thought as an educator, I appreciate Kirsten commenting on taking that moment to think and anticipate. As an educator, that's something that I always wanted my students to think about. I mean, instead of having rules and regulations, I always had rights and responsibilities as the opening day discussion. And I think it's worth in a community having those discussions like we're having now. What are we anticipating, and how do we as individuals think about our responsibility within the larger group? So I do think it's worth the thought, provoking the thought and provoking the discussion.
Yeah.
Thank you.
Great. Thank you, Ingrid. Okay, what else? We haven't talked about singing at all. Kathy?
Well, I wasn't going to go all the way to the singing thing because I know that that's, you know, we're just not in a place that is allowing that. But I was going to at least go to the humming place because that's right in the part of the newsletter, you know, that's out there. And I do think that, you know, if we, I mean, it's hard to watch the live stream and have, you know, and be in the sanctuary and not have any, you know, something.
Mm-hmm.
I didn't hear the humming this past Sunday, so
I hummed
I'm
for
glad
the
you
first.
did, Lauren.
I hummed for the first hymn, but I was a little back and a little shy.
Oh, it was you. Okay.
me.
I loved it. I was
Oh,
like,
I'm glad you heard it.
This works for right now. This
It
works
was
for right
subtle.
now.
But I think it's doable, and certainly if everyone is humming in the sanctuary, we will hear it. But I think it would be good for someone to be humming in a microphone for the live stream folks. So we are,
with masks on.
yeah, with masks on.
Right, well, yeah, totally,
It was
everything.
very sweet. It was very sweet.
You know, there was
Yeah.
a beautiful, one of the most beautiful pieces of music is the humming chorus in Madame Butterfly.
Mm.
So if you listen to that, you could appreciate how well and how beautiful a humming chorus can be.
Mm.
There's
I
a
recommend
lot
it,
of-
everybody. Ask your, what do you call it? Thing that sits on the counter. I forget her name now, but
Alexa or something.
yeah, it's going to play the humming chorus for you and you'll hear
Oh,
it.
nice. Well, so yeah, and
yeah.
Kathy, we actually already have a note to reach out to you to talk about how we might invite the congregation to think about that as a spiritual practice and really maybe engage you in your expertise in that of letting people think about that, because I really love that framing of it, not just the idea of a way for us to make music together, but also the framing of it as a spiritual practice really resonates for me.
As part of what music is, whether it's the piano or trumpets or singing or whatever, is the vibrations that we're experiencing ourselves and that we're sharing with each other, and that communal experience. And so if humming is safe, then we do that. I mean, piano is safe, we can do that. Trumpet and flutes are not necessarily safe, right, you know, for what we're saying right now. So yes, I think that would be great. And you know, I think there's just some ideas floating around, and maybe others, that could there be some kinds of music outside the church before service, kind of other kinds of ways. So just to say that as far as I know, as you know, with certainly folks, and I'm sure other musicians, that even if we can't be doing it in the traditional ways we've done in the service, I think there is a longing to share that, you know, around the church. And we just want to make sure we're staying within, you know, the guidelines and the protocols and so forth. So we may have to like be back from the steps or whatever we have to do. So how we keep those conversations going, just please, you know, reach out to me or Cynthia. I haven't talked to Cynthia about stuff, but anyway, you know, I think all of us are happy to try to be creative around that. So, and as far as, I'll just say, put this out, I mean, folk group starts meeting back at the church on Thursday, but our plan is to be effectively on the portico and not really in the church. I mean, we'll have those doors open, we'll be utilizing chairs and that kind of stuff. So we'll just start with that and we'll see, we'll see where we go and see how the weather and the light and the bugs and everything cooperates.
Yeah,
So,
great. Wonderful. Thank you, Kathy. Jonathan, go ahead. What's your follow-up?
So first I want to say, one, sorry for being in the dark because I'm in the car. And also thank you to everyone for putting so much thought into it. My follow-up, I guess, I totally understand and agree for the most part with the comment that it's really an individual risk decision for people to decide whether to attend or not. But I guess my pushback a bit is that if that's the case, why did we ever close? And why did it take so long to reopen? And as well, it sounds like there is some possibility that there is a level of risk high enough that we would close again. So I guess my pushback a bit is that doesn't seem to actually be the case, given that there's a committee making a decision. So I would like a bit more input, I guess, about is there actually a threshold in any that was considered, and if yes, what that threshold is, so that it's not a following the herd to stay open or to close in the future.
Yeah, Rich,
Can I
do you?
take that?
Yes, please.
A couple of things. I think one of the things that's changed from once we initially closed down entirely was the fact that now we have, particularly in our congregation, a significant number of people who have been vaccinated and are fully vaccinated. So the risk in terms of the overall population has decreased significantly. The Delta variant obviously has changed some of the dynamics around that and the waning immunity, as I mentioned, but still compared to where we were before there was a vaccine, it's a bit of a different situation. Again, that could change, and I don't know if we have an exact threshold that says once you reach X number of cases or X number of positivity rate or whatever, that things are going to change. We're not doing this in a vacuum as well. The city will be making changes and the state may make changes as well in terms of what they're going to, if they put another emergency order in place, and that could affect what happens at South Church based on a statewide emergency order or a citywide emergency order. So it's not simply what we decide individually as a church, but what is also happening in the larger larger community as well.
Yeah. Okay. I don't see other questions. I really appreciate people taking time to be here tonight. I really appreciate the thoughtful questions that have been raised and the really vibrant conversations that we've had. So thank you everyone for that. Susan, I sent you a little request in the chat box. Did you see it? I'm going to put you on the spot now because I don't think you saw it, but I'm hoping maybe you'll give us some closing words before we leave.
Thank you. I did not see that because Kathy said yes to me. So let's just take a moment and be ever so grateful for this opportunity to have a community in which we can raise questions, which community where questions are appreciated and received with intention. And let's remember that intention is kind of the word that we have, intention to have the best spiritual lives that are possible, intention to keep connections alive and well. The ability to gather, even if it is by Zoom, is an intentional way to stay connected. Mm-hmm. There is so much that is weighing hard on our minds and hearts, and I pray and I send love and affection to each and every one of you. I send great appreciation for all that you bring to this world and to South Church. May you be blessed and may you continue to be a blessing to others. Thank you. Good night. Bless you all. Amen.
Thank you all.
All right.